Hi, everybody. I'm Lisa Tversky, and here with me now is Ilan Javanfard. Welcome back. I am really excited. You're going to be presenting at the conference a workshop entitled Prove It, Implementing Measurement-Based Care. And maybe you want to tell us a little bit about what that is going to look like, what we're going to hear about in this very important topic that you're going to be covering.
Thank you. Thank you for having me. A recent study that came out indicated that less than 20% of clinicians throughout the United States use any form of measurement when it comes to their clinical practice. And what we found is that clinical judgment alone in work can lead to clinical inertia, that moment of feeling like things are not moving along, or you kind of have your tire stuck in the mud with no traction going on. So what we're going to discuss is how to select the appropriate measures to start tracking them in a private practice setting or in any kind of clinical setting, how to incorporate time to complete those measures, how to keep track of that data, and most importantly, what are the most important, useful, and data-driven measures that are available that are free and accessible to everyone. People who attend will leave with a list of free measures that they can implement if they had a session the moment after they left the room, in hopes that they can start providing their clients with the necessary information to prove that they are worth the work that they're providing.
Do you find that clinicians, once they understand and can see how to, and that it's fairly simple and they have tools available, do you find that clinicians are eager to start doing this? Is there a resistance amongst the clinicians? What do you find?
It's a wonderful question. We do discuss the resistance because oftentimes there is resistance at first, particularly from clinicians who have not invested time in using outcomes for the majority of their career.
Right.
But what we have found is that the utilization of outcomes, once you start with it, it's one of those things where it's kind of like riding a bike. You just start to kind of progressively get better over time. And it is a wonderful tool to increase your referral streams and increase your clinical practice, because you will have data to prove that what you actually are doing works. How wonderful would it be for a clinician to be able to say to a client who calls, in 6 weeks, you should see a 30% reduction in your depression symptoms. And if you don't, then maybe we need to change what we're doing. Wow. That investment is going to be a way to get people to buy in to the upfront cost that therapy oftentimes comes with, knowing that they're going to see progress.
That's a very big incentive to some of the more clinical clinicians, possibly, and very interesting resource for us to have, that information and that ability to measure what we're doing, since it is kind of intangible feeling sometimes. So that's really wonderful. I really appreciate you taking the time to do this so everyone can understand what they're going to hear about at this workshop. And I'm looking forward to seeing you and all of you real soon.
Likewise.